I'm here with Simon Dubois, one of our psychologists, and Kristen Zanotti, one of our naturopaths. And we're just going to have a little chat about working together in chronic health, mental health conditions. Simon, in your field of psychology, you've been in for a very long time. How are you seeing it evolve with the introduction of using naturopathy for your patients?
Yeah, it's lots of really exciting changes. Seeing things like the SBS TV show on the microbiome, gut health and mental health, and psychiatrists that are coming out like Kelly Brogan and David Perlmutter has been around as well, thinking about mental health and the health of our bodies. So it's really kicking along, isn't it, Kristen?
Yeah, absolutely. I'm really excited that there's a collaboration, particularly with psychology and naturopathy, so we can really get some dynamic results. Yeah.
And it's particularly important for me because I'm very focused on supporting people to change their sort of mental and emotional structures, but if there isn't the support of that neurobiological system behind them, sometimes I can be working and my patient can be working really, really hard, but they haven't got the support of that body behind them. So I'm able to defer to you and defer to naturopaths to assist in that area.
Absolutely. Yeah, I'm really passionate about getting a baseline with the patient and just looking at nutritional medicine, hormone health, gut health, and just really assessing and supplementing and supporting where possible, and then working together with the practices that you do. You can really see some great improvements.
I mean, one of the key things I'm aware of is that dopamine, serotonin production is critical, and if my practices are going to work, which is again around thinking about our thoughts and being able to identify unhelpful thoughts and keep them at bay, it's pretty handy to have a good dopamine, serotonin store available to have the energy and the power to do that. And I mean, my understanding gets a little bit flaky around this, but that's where the naturopath comes in and understands that production and how it works.
Yeah, absolutely. So assessment's key, and then looking at particular amino acids that really work on the neurotransmitter production, and also, again, coming back to gut health.
That good gut flora.
Yeah, the good gut flora actually produces the precursors to make the neurotransmitters, serotonin, dopamine.
That help us feel like we can cope and manage the day. So they're a marriage for sure, that gut health and that brain health, which there's heaps of evidence now that points to that direction.
More and more, yeah.
It's just lovely that we're able to work together and really start to see those results.
Absolutely.
The other great thing about naturopathic support is some people use medications to support their mental health.
That's right.
But they like to be backed up by someone who can help them manage those medications and process them. And for some people, taking a medication for anxiety or depression is difficult for them. So there's some alternatives we can consider
to support,
and try and do it in an alternative way as well.
Absolutely, and we're so evidence-based. There's some great research with mental health and using nutritional medicine to potentiate the efficacy of antidepressants or different types of medications, and then done with the safety of a doctor and psychologist. There's alternatives that we can offer as well.
Which I like here because our naturopaths aren't adverse to medications if they're necessary.
Absolutely.
So got their place.
Have a willingness to work with them if that's required.
Yeah.
So if you think you would really benefit from a combined session with Simon and Kristen, they are both available, and the lovely thing is you can work closely together because there's shared notes and you can leave each other messages, and you can really work to hone in quite quickly as opposed to working in separate places. So they're both available if you feel like this would benefit you and you've got a chronic mental health condition. So thank you so much.
Thank you. Thanks, Fran.